Ella.
How are you?
Good. Can you hear me?
Yes. Thank you so much for taking the time to speak with me today for White Coat Wonders. Your work in obstetrics and gynecology is truly fascinating, and I'm really excited to learn more about your journey today.
Oh, good.
To start, could you share what initially inspired you to pursue a career in medicine, particularly reproductive endocrinology and infertility?
Sure. So I think probably back in high school, I had an idea that I wanted to go to medical school. And then in college, I found study like just women's health in general to be a very interesting area. I was a psychology major in undergrad, and when I was in undergrad is when Prozac first came out, and it like revolutionized the world in a way for mental health treatment. And so it kind of further piqued my interest. When I first applied to medical school, I thought I would potentially do something with like adolescent psychiatry or adolescent medicine. And then I did a rotation in my third year in my specialty in reproductive endocrinology. And I was like, done. That's it. Yep. Mm-hmm. Well, there's a lot of overlap because like mental health and pregnancy and fertility, like there's a lot of interplay.
You've had a truly impressive academic and professional career from Amherst College to Johns Hopkins, Northwestern, and Cornell. What would you say was the biggest challenge that you faced, and how did you overcome it?
I think you just make a lot of sacrifices in medical training. You don't have much of a 20s if you go straight to medical school and then residency. So, but even though that was a sacrifice, like this was always my plan and I knew what I wanted to do. So it was just like another 4 years or another 3 years. Like I knew the end goal, so I didn't mind the sacrifice during it as much. It was, if it's what you really want to do, then it doesn't seem as much of a sacrifice as much as just a lot of work, basically.
Is it like more of a calling than just a career?
Yeah, I think so. I think like, if you go into medicine, you make a lot of sacrifices. And although that's difficult, it's just your job at the time.
In your experience, what aspect of reproductive medicine do you find most rewarding, particularly when it comes to patient care?
I think when we help someone like have a successful pregnancy and doing the initial pregnancy ultrasound, because we'll help patients with treatments and then they see us for an initial pregnancy ultrasound around 6 to 7 weeks. When you first see a heartbeat, like it's incredibly gratifying and rewarding, and that's what like everything they've gone through and their struggles to have that point. So I think that's really rewarding. And I like my specialty because it's like a really good blend of procedures and really interesting surgery and procedures with like reproductive endocrinology as a field, and hormonal treatments are like intellectually to me just very interesting.
That's very nice.
Mm-hmm.
Your work involves treating patients with conditions from PCOS and endometriosis. Could you share a memorable patient story that had a lasting impact on you or your family?
I think there have been some success stories with both disorders or, other disorders where people have been told they never would have their own biologic child. I can think of a couple patients with polycystic ovarian syndrome who, for example, never ovulated.
Oh.
It's a condition where people don't ovulate, and obviously you need to be able to ovulate to conceive. And I always tell patients now, I can always get you to ovulate. It just depends on what we need to do. So there have been patients like that who really thought they would never have a baby. And then it's been really gratifying to help them.
True, it does. As director of the Division of Reproductive Endocrinology and Infertility, how do you balance patient care, research, and teaching?
Well, we have dedicated academic time. So I have like an academic day a week. We always have students, residents, visiting residents, fellows, like we always have people rotating through our clinic. And so patients, are very gracious about, allowing students and residents to participate in their care. They're always given the option of whether or not, they definitely want a student, but so it's integrated into the day of seeing patients. And then I have other times where I'll give lectures or work specifically on research projects with residents and students. So a lot of it is integrated into the day, but then we do have time set aside But that is a big part of it. And truthfully, I really enjoyed the teaching aspect. It makes my day much more interesting. And I feel like you really have to know a topic well to be able to teach it. So it like keeps us up to date on things too.
It's all together. It's nice.
When we have students and residents rotate with us, we always have them give like a presentation on an evidence-based question at the end of their rotation. And then we discuss different cases or, the articles. So that all makes it interesting.
Wow. Could you tell us about any advancements in fertility treatments or reproductive medicine that you're particularly excited about?
Our clinic has something called an Embryoscope that I think is very interesting that does real-time monitoring of early embryo development, and it captures time-lapse images. So we can use that then to help pick like the best embryo, or we can look at that and kind of correlate it with other risk factors for patients that may be making it harder to get pregnant. The field has been changed by what we call cryopreservation or vitrification, which is fast freezing, which we can do of both eggs and embryos. So it really allows patients to preserve their fertility. In our current society, often people have to defer having a child based upon their career, or maybe they haven't found the right person. And I think the ability to preserve fertility gives patients autonomy.
When I was researching, I saw you helped develop a fertility preservation program. Why is fertility preservation so crucial, particularly for cancer patients?
A lot of cancer treatments, specifically chemotherapy, radiation, or some surgeries, can really adversely impact someone's ability to get pregnant. Like a lot of chemotherapies, specifically alkylating agents, can negatively impact women's egg reserve. Women are born with a set number of eggs, and with time in everyone, the reserve of eggs declines. And so oftentimes people may have chemotherapy, and then they have to wait to try to get pregnant for several years to make sure that they're cancer-free before they try to get pregnant. So you have not only chemo, but then having to wait several years that can negatively impact their fertility and their egg reserve. So to be able to freeze eggs or embryos before they have chemotherapy allows them to preserve fertility and kind of have those available for the future when they are able to try to get pregnant. They can then try with their frozen eggs or embryos. So, I think there have been tremendous advances in treatment for cancer, and a lot of people are living longer and having like a much better quality of life down the road. And studies have shown that being able to have a family is a really important part of that.
It's truly astounding what you guys have done with the program.
Mm-hmm.
What do you find most challenging about working in reproductive medicine, and how do you navigate the challenges that you may face?
Infertility is like a very difficult process for patients. Studies have shown that a diagnosis of infertility is similar to a diagnosis of cancer for like the psychosocial stress it causes patients. So I think being able to kind of provide support for patients while giving them treatment options, it's hard. It's a really hard process going through fertility treatment. That's why it's called a fertility journey. So I think we all wish that everybody could be successful, but sometimes people have really hard diagnoses or conditions, and it is really distressing to them and makes us feel badly as providers if we are not successful with their treatment. So miscarriages are really hard. We see a number of patients who have what we call recurrent miscarriages, where they have 2 or more miscarriages. And so it's very emotionally difficult for patients going through this. And that's just hard to see as a doctor.
As you just stated now, working with patients facing infertility can be emotionally challenging and taxing. How do you approach sensitive conversations with them and ensure that they feel supported throughout their journey?
One of the things I always try to do at the beginning of a visit is I ask a patient what her concerns are and what her questions are and what things are important to her. So I know, because all of our time is limited, and I want to make sure that if I see them, that I'm seeing a patient that I can try to address her needs, not the idea of what I had is important for her to discuss. And I not uncommonly will find that people have concerns or questions from things they've seen online or other areas that I can help reassure them about. I also ask people how they feel about fertility treatment, because not everybody wants to pursue it. Sometimes people have a preconceived notion about fertility treatment, or sometimes they have certain concerns about it. So I think the first thing that's important to do is just try to hear from the patient what's important to her.
You truly have to be empathetic, and it does show.
Yes.
For students like me who are interested in pursuing medicine and hopefully attending a BSMD college, what advice would you give out about choosing a specialty or navigating the path to medicine?
So I would say it's a great career. It's like, you can you can seek out opportunities, be it academics or private practice, and it's a very gratifying career. And like I said, it's a lot of hard work, but I think it's worth the sacrifice. I always tell students to go into what they find most naturally interesting, meaning if there's like an area that's very interesting that you want to read a lot about, or you want to read studies about, like that is your area, because you're going to spend your life committed to learning and taking care of people in that area. Don't choose an area for other reasons that, someone told you, or, for what other reasons. But it's really important to pick something that like intellectually inspires you, because that will also help you be the best doctor in that area.
It will, definitely. You've taught countless medical students and residents. Looking back on your own personal journey, if you could go back and give yourself one piece of advice, what would you say it'd be?
Another important thing about medicine is that you work part of a team. And I always think I had really nice relationships with my residents, with my co-residents, with my fellows, with my attendings. And I don't know that I would have done something differently, but I think you maybe don't realize that as much when you're going into medicine. How much of it is a team, and how the people you work with and being kind of similar to them in practice is really important. So as head of the division, I think it's been nice that the people who have joined our division, like we have similar practice styles and kind of feel the same way about a lot of topics. And that's really important, is like the team aspect. I don't think I really realized that, but you eventually work closely with nurses. As physicians, we can't do what we do without nurses. I can't do what I do without my front desk staff and my medical assistants and our embryologists. So kind of valuing everybody in that team and letting them know that is really important.
Yes, without one of them, then it wouldn't work together.
Right.
That's what my dad always talks about.
Yes.
You're deeply involved in the Milwaukee community, serving on boards like here, Wisconsin, Pennifield's Children's Center. How do you balance your professional responsibilities with giving back to the community and volunteering?
I just think it's something very important to give back to the community. Full disclosure, I'm no longer on those boards. I just rolled off them because I'd been on them for a while. Now, my husband and I are pretty involved also with the Milwaukee Academy of Science, which is a charter school that's STEM-based, that's affiliated with MCW. I just think I've had a lot of great opportunities in my life, and I want to be able to give back. One program we have at MCW is called AIM, and it is where high school students from diverse backgrounds come and shadow us and like rotate through and spend time. And I've like really enjoyed that. I've enjoyed giving lectures or helping to support MAS, which is the Milwaukee Academy of Science. So that's just something that I see an extension of my decision to go into medicine and care for patients, to give back to the community.
I researched AIM when I was looking for opportunities for shadowing.
Yeah. You should. I think it's a great program, and you give a presentation at the end. Another BA student did it maybe 2 years ago.
Then I'll see and follow up with them. Lastly, you've also co-captained your tennis team at Amherst. How do you think your sports experience impacted your leadership role both in medicine and in life?
I think sports prepares you really well for a career in medicine. Like, playing junior tennis and college tennis at times is really nerve-wracking. It's anxiety-provoking, it's pressure, it's stress, but you're also part of a team. And all of that prepares you for exams, board exams, difficult surgeries. You prepare, I think that playing sports is just such a valuable experience when I was taking my oral board exams for OBGYN and reproductive endocrinology, I thought to myself, I'm probably as nervous as I was for junior tennis tournaments. Truthfully. So kind of prepares you for that.
Wow, yeah. I'm in cross country during the fall, and it's truly mentally taxing, and my mom needs to prepare for you.
It is. It's really good experience.
Dr. Schoyer, this has truly been an inspiring conversation. I have appreciated your time and insights today, and I'll follow up with you once the blog post is ready.
Sure.
Thank you for watching this episode of White Coat Wonders. I had a truly incredible conversation with Dr. Schoyer about reproductive medicine, fertility advancements, and her own journey in OBGYN. If you enjoyed this interview, make sure to like, comment, and subscribe for more conversations with leading physicians in their field. Check out whitecoatwonders.com for the full blog post and more medical insights, which will be linked down below, or search it up in Google. And let me know in the comments down below what specialty you'd love to see next, and I'll see you in the next interview.